Hi, my name is Miyuki Fukui. I'm a PGY3. I went to Drexel for medical school, and I'm originally from California. I chose Temple Psychiatry because I wanted to become a good attending. And I think a big part of that is being able to see a lot of patients who are high acuity, so that when you are an attending, you kind of know how to treat these patients. So through Temple Psychiatry, I've been able to see a lot of catatonia, NMS, like acute psychosis, agitation, substance use, and I feel like I'm much more comfortable with those psychopathology than I would be anywhere else. I feel like this was the right program for me. The faculty and the administrators were very, very open and honest with us. We were having daily emails, weekly check-ins to kind of see how things were changing. One of the things that they definitely made sure was that we weren't getting pulled into other services. So all the psychiatry residents continued to practice psychiatry, which I think was really big, because we didn't get pulled into ICU or the medical unit, places we aren't used to practicing. The other thing was that we had to open up a COVID psych unit. And once that was a little bit more established, they made sure that the residents who were working on the unit volunteered for that unit. So the people who were being potentially exposed to COVID-19 were people who volunteered to be there in the first place, that felt comfortable doing that job. In terms of kind of how our salary has been, I know some residency programs had their salaries cut. So not only did our salaries stay the same, but they actually gave us kind of an award. So they actually gave us extra pay for being frontline workers during the pandemic, and it was really obvious to us that Temple really cared about our well-being, but also our financial well-being as well during this time of crisis. So outpatient psychiatry is great here. We all practice outpatient psychiatry mainly at Episcopal Hospital. And even though it's one clinic, we see all sorts of patients. On my patient load, I see patients with body dysmorphia. I see patients with severe personality disorder, with acute psychosis, but also kind of the run-of-the-mill depression and anxiety as well. So I feel like I have a really good understanding of how to treat those. A lot of the supervisors here that oversee our work are psychodynamically minded, so I'm learning a lot about kind of really basic psychodynamic concepts, but more importantly, how to apply them to my patients. A lot of the residents get along really, really well together. We used to have like weekly happy hours, and now in the time of the pandemic, we haven't really been able to do that, but we're trying to supplement that with Zoom happy hour, going to the park, and enjoying our company in a very socially distanced, responsible manner. Also, one of the things that our program really fosters is getting our own therapy, so we know what it's like to be on the other side of the couch. So I think the majority of us, especially as PGY3s, are in therapy now, and that's kind of helped me stay well throughout this pretty intense program.